What is a perforated septum surgery all about? Well, in a perforated septum surgery, what we're trying to accomplish is, simply put, closing the hole in the septum. That will involve closing the perforation on one side, placing a cartilage graft in the center, and then closing the mucosa on the other side. So it's a 3-layer repair. That gives the best results. If you only do one layer on one side, you can do a quicker operation, but the chances of failure are very high. So the technical aspect of this surgery is really making sure you have a 3-layered repair, which leads to a high success rate. The surgery is typically outpatient. It is under general anesthesia. It doesn't involve breaking any bones. Many times it can be done endoscopically, which does not require any incisions on the outside of the nose. And the recovery is about 3 to 5 days. So I encourage you to seek out a septal perforation specialist or come into our office for an evaluation and learn about all your options for surgical repair of your septal perforation.